AI won't replace therapists. Therapists using AI will replace therapists who don't. If you're a therapist, psychologist, counselor, or even someone looking for the best mental health help, pay close attention. AI is not going to steal your therapist jobs next week. But here's the part clinicians need to hear. AI will not replace good therapists, but therapists who know how to use AI may replace therapists who refuse to use AI. And by the end of the video, I'll explain exactly what that means. Because this is not about letting AI do therapy. That would be a terrible idea. It's about using AI the way a surgeon uses robotic hands to do surgery or uses MRI to perform, gets information, but the MRI doesn't perform the surgery, the surgeon does. But would you rather have a surgeon operating with a scan or one that says, no thanks, I prefer to work on vibes? Therapists are no different. Every clinician has blind spots. I don't care how experienced you are. You have your training, your personality, your politics, your usual tools, your own way of seeing people. That's not a flaw. We are humans. But it also means you may miss things. You may see anxiety where there is trauma. You may see defiance where there is shame. And this is where AI can become either your best friend or your worst nightmare. Used badly, it's dangerous. Used lazily, it makes you weaker. And please do not put private clients' details into some random AI tool and call it innovation. We like ethics. We like licenses. We like not being sued. But used correctly with clinical judgment, privacy, and a trained human filter, AI can expand your thinking fast. Imagine a client comes in with panic attacks, relationship chaos, shutdowns, shame spirals, and a history of trauma. You might have a strong case conceptualization, but AI can help you pressure test 5. It can help you think through CBT, attachment trauma-informed care, somatic tools, DBT skills, psychoeducation, and it may give you questions to ask you have not thought of before. It gives the therapist more angles, more language, more tools, more ways to help the client feel like finally someone understands what I'm actually going through. That's the difference. One therapist is working from just memory. The other is working from memory, training, experience, empathy, and the world's largest clinical brainstorming partner. Slight advantage. Tiny little detail. Only the future of the profession. Imagine what happens when clients stop ghosting because they feel more understood, when treatment gets sharper, when sessions feel more personalized, when you're not limited to only what you remembered from grad school or that continuing education with bad coffee. I am Dr. Sharona. I work with clinicians and parents who want to use AI wisely to improve care and protect themselves and their families from risks. Because AI will not make a bad therapist great, but it will make a good therapist very hard to compete with.